really the patient that changed this situation for me. This is now, because of this patient of mine, this is now part of my standard of care. This is not something I provide as an option for a patient. If they want to be followed in my practice for HPV positive oropharynx, they have to get this test. There's nothing I can do because this is a patient who received 2017 primary surgical therapy, TORS, neck dissection, N0, T2, deferred radiation appropriately. There was no indications, and he was doing everything right. He's a middle-aged guy, had a post-surgical PET scan, 3 months, negative, clean, everything's good, asymptomatic, recovering well, comes for his endoscopies, there's no evidence of recurrence disease. And at this point, I start hearing about this cool blood test. I'm like, oh, let's be fancy. I always like to see what's nice and fancy and shiny. So I ordered it almost on a lark. I get this, and I remember actually was on vacation when I got this email, and I flipped out. I was like, oh my God. So I flipped out, and automatically I called him from vacation, and I just ordered the PET scan. Now, I would have gotten a second test. But this was like, he was maybe my 4th or 5th patient that I requested this on. I got this PET scan, and there's a sub-centimeter recurrence, high level 2B, which I dissected out. But it was the one that was like probably a little tiny cell up there behind the jug, way high up in 2B, and that's where it was. It was underneath the SEM. I wouldn't have felt that for probably 3 months. The first symptom he probably would have had was cranial nerve deficits or potentially mastoiditis. Who knows how he would have presented? But there's no question that his prognosis was dramatically altered by the fact that it was random. He's doing great. They salvaged him with chemoradiation, and right now he's doing great. And this saved his life. In my opinion, there's no question, saved his life.